A new study, a groundbreaking study out, found many women diagnosed with early-stage breast cancer may not need chemotherapy as part of their treatment. Here to explain what this means for patients, Dr. Margaret Van Meter, Intermountain Medical Center oncologist. Thank you so much.
Thanks for having us.
This is a huge study which also affects a lot of women with breast cancer. Let's talk and walk us through this huge study.
Yeah, so this really does change the way we treat early-stage breast cancer, because in the past we were only going on the tumor size and how far it has spread in the body to determine whether someone might benefit from chemotherapy. What we see now is that if we look more closely at the tumor and the molecular characteristics of the tumor, some of those cancers actually don't benefit from chemotherapy, and those patients will do well with just hormone blocking pills alone.
And we want to be very careful. This does not include all breast cancers. So which types are we talking about? And it's women who are younger and early stage, is that correct?
Not necessarily the age, but absolutely. So these are generally women with a stage 1 or 2 breast cancer that has not spread to the lymph nodes. This would exclude breast cancers that are HER2 positive or triple negative. So it's cancers that have the estrogen receptor. Now this is the majority of our patients.
You're saying some 50%?
Yes, about 50% of patients have this at diagnosis. Yes, so it is affecting a lot of people, but not everybody.
This is an extensive study that came out, some 10,000 women, international. Give us some details.
Yeah, so over 10,000 women across the country and internationally as well. The largest study ever conducted for breast cancer patients, and this will change the way we practice from here on out.
Published in the New England Journal of Medicine, a very big deal. How does this change potentially the practice here at Intermountain Medical Center and maybe across the country?
Yeah, across the country. So we have been using this molecular test on cancers for many years, over 10 years now, but there was a gray area where we weren't sure exactly how to manage cancers that seemed to be a little bit more aggressive, but not quite as aggressive as some other ones. So this helps eliminate or at least reduce the size of that gray area. We are more able to confidently say that people don't need chemotherapy, and we can provide some of that reassurance to patients.
You know, this is good news for people, so we don't have patients go through chemotherapy.
Exactly.
But also, how do you allay the fears that some women may have that say, well, is that really going to help me? Am I going to still be safe and okay?
Exactly, and that's a very important part of the study. We have excellent data that without chemotherapy, people are living many years without their cancer coming back. Over 98% of them are living with that. So it is a bit concerning to feel like you're missing out on a treatment opportunity. But again, back to the molecular tumor characteristics, not every cancer is going to respond to chemotherapy. And this test helps us figure out who really will benefit.
And the research and the years behind it backs that statement up. Thank you so much for that information.